Death and Eternal Life After Death. A Monday, November 24th, 2008 posting on death and dying. Friends, Dato and Tan Sri, even hardcore chap like me in a hardcore specialty like cardiology, supposedly supposed to be immune to death, do sometimes feel down, weighted down by the sense of frailty in man when we have to face death. Too many issues surrounding death this week. Firstly, that young Indian chap who died under my care last week. Just 32 years old with a young Indonesian wife and 2-year-old kid in tow. He died of severe congestive cardiomyopathy. A halting soap, half Indian, half Indonesian, over the cold, lifeless body of her young husband haunts me. Then my mother-in-law, her lungs and heart already riddled with cancer cells, hanging on to dear life on an expensive state-of-the-art moral medication, Tasiva, that is supposed to buy time for a couple more months before the cancer cells get the better of it and invade further. She is quite oblivious of her fate. Ignorance is bliss, so they say. We doctors oftentimes have to play God a lot more than we want to in this part of the world. Asians do not generally want to know the whole bad news. Telling too much can be wrong. Too little, you will get lawyer's letter on your desk when the undiscussable do take place prematurely. In her case, I can expect a couple more months of honeymoon and put a couple of more months of honeymoon, or probably a year or two, and personal reprieve, then the progressive deterioration in breathing, loss of cognitive functions, and a generally slow slide to unconsciousness. Then my little empire will be in turmoil. I think I have a heart of stone by way of upbringing, since I was orphaned at the age 9, and by training, my medical training. But to see loved ones suffer from the impending loss of their loved one would be difficult even for Master Stone or Dr. Stone. Then there is this case of a dear colleague of mine this week whom I inadvertently found and diagnosed to have advanced cancer just on a routine annual medical checkup. If you find my conversation with him macabre or callous, do not judge us, because we fellow physicians do not need veils when we discuss things like death. So my friends, since there are already 4 foci in the lung which looks like metastatic cancer to me, what are you going to do? Knowing that this sort of cancer is resistant to all kinds of therapy. A rather stupid, superficial question on my part, because actually not very stupid as it seemed, as I was assessing his philosophical leaning. Dr. Sabri, the man, said, "There's nothing much for me to do, Nick, except to accept this reader and live my life from day to day," was the brave and stoic reply. I know the man well. With reader, for want of better word, that is acceptance in English, half the battle is won. Won not against the big C, but against the internal demons of fear and oftentimes kufur. Many a time we practitioners observe a deep initial sense of denial in our patients, which later change to anger. Oftentimes anger towards their caregivers, and frequently and frighteningly as well towards God. The why me syndrome sets in, which result in kufur. In moments like this, we should thank our lucky star that we are Muslim. We have rida to soften the blow, we have kafarah, we have taubat and atonement, we have prayers, and we have zikrullah. As supreme optimists, and that is what we Muslims should be, death is not the end. Optimists not in the secular way that come what may, we are going to delay that moment of death by mega vitamin doses, old Inca medicine, yoga, best treatment that money can buy, etc., 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 and etc., or some obscure Chinese or Mexican cancer hospital somewhere. No, no, no. None of these claims and super claims, but by the realization that with the inevitability of forthcoming death, we are moving on to the next phase of life, a better one by any scale of measure, if we are prepared for it. It's not even the beginning, it is the end before the new beginning, the eternal journey. Dunya in Arabic is not just world in English as we know it, as an exact transliteration of the word. Dunya connotes a lower form of existence, while akhirat means a higher form. We are thus moving from a lower animal-like existence with all the inconsistencies and inadequacies of the lower nafs to a higher, more ephemeral existence of the higher spirit, the eternal journey. My friend, I cannot offer you anything, but actually when I come to think about it, you are in a better position than numbskulls like me and millions others who today go through life heedlessly, never giving a serious thought about him and our eternal journey, thinking we have 20, 25, 30 more years, and one fine day suddenly got caught with our pants down tomorrow or day after, just like that young Indian patient of mine. In your case, you know you have 6 months plus minus 6 and work hard at it, while in our case we tend to forget about Allah because we think we can live forever. As I walk away from this room, I felt very relieved that my dear friend has accepted his qadar very well with Rida. Inshallah, he will be in good hand. I cannot but remember the profound thought of the young jihadis who famously said, "To me, it is like walking away from a hot furnace, opening the door and walking through into an air-conditioned room." Let us all work earnestly hard towards that kind of conviction. Death is, after all, the beginning of eternal life. Yes, at the end of our time, we should not fear. If we are well prepared, it should be like walking from a hot furnace into an air-conditioned room. That young jihadist has understood the full meaning of existence in this dunya with all its shortcomings and inadequacies, and look forward to higher existence in the akhirat. May their souls be placed among the blessed. Dr. Nick Hawk, 2008, posting. Subhanallah, walhamdulillah, wa la ilaha illallah, wallahu akbar, wa la hawla wa la quwwata illa billahil aliyyil azim, wa la hawla wa la quwwata illa billahil aliyyil azim, wa la hawla wa la quwwata illa billahil aliyyil azim.